Hello, everyone. Welcome to this week's NDARC webinar. I'm Amy Peacock. I'm a researcher at the National Drug and Alcohol Research Centre, and I'll be the chair of your webinar today. To start off with, I would like to pay my respects to the traditional custodians of the lands on which we meet today, which in my case is the lands of the Molinia people. We pay our respects to elders past, present, and emerging, and extend that same respect to any First Nations people who are joining us today. So again, thank you so much for joining us for this webinar. We have such a fantastic topic and two great speakers for today. Today, we're going to be hearing about a very topical, maybe controversial area of research, the impacts of parental supply on adolescent alcohol use, findings from an 11-year study. In terms of speakers, as I mentioned, I'm delighted that we have two speakers today on this very important topic. Firstly, we have Dr. Philip Clare. Phil is a biostatistician for the Prevention Research Collaboration at the University of Sydney, specialising in causal inference using observational data and the use of machine learning in causal inference. Phil is joined by Dr. Wing See Yuen. Wing is a research fellow at NDARC whose research interests include examining trends, trajectories, and predictors of alcohol and other substance-related harm among young people. Both Phil and Wing have been absolutely pivotal in the study that they're going to be talking about today, the Australian Parental Supply of Alcohol longitudinal study. This was or is a NHMRC funded longitudinal cohort of young people in Australia, but I won't preempt their presentations and tell you too much now. We are going to have a panelist join us at the end of the webinar, and we're going to have plenty of time for questions at the end. So please do send them through to us. If you pop your questions in the Q&A function, not the chat, and I will present them to our speakers and the panel at the end of this presentation. As always, we may not have time to ask all of them, but I'll endeavour to do my best to get as many questions to them as possible. But given we have two speakers and such an exciting topic, it's time to kick off. I might invite Phil to turn on his camera and to start the presentation. Thanks, Phil.
Thanks for the introduction and for having me. I will just preamble just by way of apology. I've had the flu the past week and a half. I still have a little bit of a cough, so apologies if I cough right into the microphone while I'm talking. I'll try and keep it to a minimum. So as Amy said, Wing and I are going to be talking about some findings from a longitudinal study called the Australian Parental Supply of Alcohol study. I'll be talking about some parental supply specific findings, and Wing will talk about some more general alcohol use findings and mental health and substance use. But before we get into that, we'll just start by giving a bit more of a background about this study. It's quite a big study that's been going on for quite a long time. Mirroring Amy, before we begin, I'd like to acknowledge the Bidjigal people, the traditional custodians of the land where I live and do most of my work, and the Gadigal people, where much of this work was done at the National Drug and Alcohol Research Centre. I'd also like to acknowledge an enormous number of people who have contributed to this project over the past roughly 12 years. We have a massive team of investigators, both kind of chief investigators through various grants. This study was originally funded by the ARC and then by Rotary Health and then by the NHMRC. So there's been quite a few different grants with a range of different investigators, and then a large number of research officers and research assistants and various people have contributed over the years. And this study would not have the quality that it does without those people's contribution. I'd also particularly like to acknowledge the input into this study that Professor Kipros Kipri had. Unfortunately, Kip passed away at the end of last year. But he was kind of pivotal in the creation of this study, and his legacy is definitely felt very, very strongly in the strength of this study. So why study parental supply of alcohol? Alcohol is the leading risk factor for death and disability in young people. That happens both kind of in direct harms, so things like intoxication, injuries while intoxicated, risky behaviors and sexual activity while intoxicated, and things that occur due to impaired brain function. So acute short-term risks, which are very common in young people. It also begins, I guess, a trajectory of alcohol use, which leads to more harms in the longer term, particularly with risky drinking. So that includes alcohol use disorders. And then in the longer term, alcohol use has been linked to a range of cancers, as well as cardiovascular disease. And much of that trajectory of alcohol use begins in adolescence and early adulthood. So it's very important to look at what's happening in those early stages when alcohol use is being initiated, and what's happening in terms of where that alcohol comes from and how it begins. At least in people under 18 in Australia, so I will say that this is relatively specific to Australia, but at least in Australia, the most common source of alcohol for young people is their parents. In all jurisdictions in Australia, it's legal for parents to supply alcohol to their children for consumption in private premises, so in the home, for example, as long as that consumption happens under supervision. In most jurisdictions, so the exceptions being Northern Territory and Queensland, supply can also happen from other people, as long as that supply occurs with parental permission. So the only legal source of alcohol for young people is either parents or people supplying essentially on behalf of parents, so with parent permission. And the reason for parental supply tends to be, if you ask parents, that it's given as a way of introducing alcohol in a safe environment to promote moderate drinking behaviors. This is often done in reference to, I guess, the kind of the European, very European-centric of introduction of alcohol, where it's very common for example, wine to be consumed by adolescents with dinner. Those kinds of drinking behaviors where it's not kind of risky drinking, but just low levels of consumption with food in the home in relatively safe environments under supervision. And that tends to be the reason why parents supply, to introduce safe drinking behaviors. But at least when this study was created, there wasn't really any evidence to say whether that was happening. So that was certainly the driving kind of force behind parental supply, but it wasn't clear whether it was actually introducing safe drinking or moderate drinking. Rather, that was just the thinking behind it. The few studies that did exist had fairly poor control for things like confounders and covariates, so other risk factors that might contribute. So this study was created to specifically investigate the effects of parental supply of alcohol in adolescents and across adolescents. We recruited way back starting in 2010. The wave one occurred over 2010, 2011, and we recruited 1,900, just over 1,900 parent-child dyads from just under 50 grade 7 cohorts across New South Wales, Tasmania, and Western Australia. So we approached schools, recruited parents and their children from within those schools. And then we followed them up over 11 years. So as I said, baseline happened in 2010, 2011. And then there was annual follow-up right up until COVID. We still had our annual survey during COVID. Our surveys kind of go October, March is one wave, and then it starts again. So the lockdowns in New South Wales in particular happened between waves rather than during waves. So it didn't interrupt our general data collection too much. But we did introduce a special additional COVID-19 specific survey in between wave 10 and 11. So we approached about another 500. So about a quarter of the sample we approached to do an extra interview. And then following wave 11, we also did a structured diagnostic interview. So we used the city and we included a range of mental health and substance use disorders in that structured interview. So depression, anxiety, social phobia, cannabis use disorder, stimulant use disorder, a few others. And Wing will talk about the results from that side of in a little bit. In wave 5, we just before they hit adulthood, we unfortunately had to stop following up the parents. So from wave 6 onwards, only the children were followed. It would have been nice to get maybe one more year, but unfortunately the money dried up and we just couldn't afford to interview the parents as well. But we do have parent data from wave 1 to wave 5 in parallel to the child data, and then adolescent, young adult data across the 11 waves. And this particular study do have a number of published papers over the past half a decade. And broadly what we've shown up till this point, up to the point of the papers that we're going to be presenting today, is that parental supply in comparison to no parental supply increases risk of heavy episodic drinking, so that's drinking more than 4 drinks on an occasion, increases risks of alcohol-related harm, so things like accidents, violence, hangovers, those kinds of things. Increases the risk of alcohol use disorder symptoms, so this is self-reported symptoms of alcohol use disorders. But it also increases the risk of subsequently getting supply from other sources. What research has shown is that parental supply of alcohol, generally speaking, is less risky than a self-supply or supply from peers. But those who receive supply from parents are more likely to subsequently go on to receive alcohol from their peers and from self-supply. So it really does appear to begin a trajectory of drinking. We have not up to this point seen any evidence that parental supply is protective or that it leads to more moderate drinking. Rather, it's been linked to a range of alcohol-related harms. But those findings have largely been focused on early, late adolescent outcomes or very early adulthood around age 18. So really right at the cusp of hitting adulthood. This study, these studies, because we're presenting the findings of essentially 2 studies, are really looking at the effects of both parental supply and alcohol use across adolescents on outcomes that occurred in early adulthood, so from around age 18 to about 23 when follow-up ended. Just to give an idea of how common parental supply is, or at least was in this cohort, it's pretty common. So not that many kids get supplied alcohol when they're very young, but it's still surprisingly common, I guess, given that, like at the younger end of this spectrum, we're talking about 13-year-olds, more than 20% reported receiving alcohol from their parents. By 17, that's well in excess of 50%. And that aligns broadly with what we know about the initiation of alcohol, which is that the kind of the median initiation for alcohol use is about 16-ish years in Australia. So by 16 years, most adolescents, at least most of those who are going to initiate, definitely have, but it's around half of kids who have initiated alcohol by age 16. When we look at how much is supplied, a lot of the supply that happens particularly early on is sips, so just a taste of alcohol, but that fairly quickly escalates, and certainly by 16, 17 years, kids are very commonly being supplied with kind of a whole drink at least, so say like a whole glass of wine with dinner or something like that, and slightly less commonly with things like six-packs, so 5 or more standard drinks in an occasion. So that might be a case where a parent, say, knows that the kids are going to have a party and they're going to get alcohol, and decides to supply themselves rather than risking the child getting it from a place that's not safe. So for this particular study, we took we took a causal inference approach. We have pre-registered hypotheses, and our hypotheses were that supply, so when we talk about supply, we're talking at different levels. So any supply, which includes sips, supply of whole drinks, or regular supply, which we define as more than 3 times in a year, will increase the risk of heavy episodic drinking, alcohol-related harm, and alcohol use disorder symptoms in early adulthood. Our exposure period for those exposures is up till 18, because parental supply really, when we're talking about it, what we're talking about it is in adolescence. In Australia, once you reach the legal age of self-supply, parental supply of alcohol starts to become slightly less important. Although it still can occur, as I mentioned earlier, supply from others does tend to be associated with greater risk. And as they hit that age where they can purchase alcohol themselves, the relative importance of parental supply is diminished. So we focused for this research on supply and later consumption that occurred in that adolescent period, from kind of 13 to 17 years. We control for a range of confounders that were identified from the literature way back when the study was created. Those include child confounders, parent confounders, so things like how much alcohol was consumed by the parent, family confounders, so things like how good the relationship is between the parents and children, whether there are alcohol-specific rules in place, and those kinds of things, and peer variables, which are largely whether their friends are using alcohol, and whether they think their friends approve or disapprove of substance use. And the outcomes, as I said, are in early adulthood. We have a range of them, probably too many to go into them very specifically, but broadly covering the domains that I mentioned. So heavy episodic drinking, alcohol-related harm, and alcohol use disorders, both measured via self-report, and also using the clinical diagnostic interview, the CIDI. The results that I'm presenting are estimated using a causal inference model. I'm not going to go into a great deal of detail here. It's quite complicated, and most people their eyes tend to glaze over when I go into too much detail. I'm very excited by it, but most people, I understand, don't really care. The only thing that I'll mention is that that this is a method that's kind of at the forefront of statistical inference. It is implemented using machine learning. So we use machine learning to estimate some kind of component models, the underlying models, and then we combine them using an iterative technique to get a really targeted causal estimate. So the use of machine learning in this case, because we're not actually using those underlying models for inference, that tends to be a big problem with using machine learning for inference, is that it doesn't produce kind of interpretable results. But in this case, we're not actually using those initial models. We're just using information that comes out of them. It's only the final model that's being interpreted, and that is typically from just a regular generalized linear model. So we can use machine learning to get really good targeted estimates without having to worry about the downsides of using machine learning to get inference. There's a link there for the pre-registration if anyone's interested, but no need. So what did we find? Broadly speaking, not too surprising. So we tested supply occurring from a range of different ages. So if you can think about the leftmost column as being it's supply that started prior to age 12, but you can think of that as supply that occurred across the entire study period. All of our participants were 12 by the time they started. So supply that occurred starting prior to age 12 basically means that everyone in the study getting supply across the entire study. At the other end of the spectrum, supply from greater than 17 would be no supply at all. So what we looked at was whether the age at which supply occurred also was linked to these outcomes. And what we see is basically that there's kind of an inflection point, a point of change. So definitely those who were supplied early, before 12 or from 12 onwards, showed higher risk of heavy episodic drinking, higher risk of self-reported harm, and at least some suggestion of higher risk of alcohol use disorder, although that was limited to the city DSM-5 alcohol use disorder. So we didn't see any elevated risk of the kind of the old definitions using the DSM-4 of DSM-4 alcohol abuse or alcohol dependence, only of the DSM-5 alcohol use disorder. And then there's kind of a gap. So if parents started really early, definitely elevated risk. Starting from age 13, 14, not so much. And then 15, we see the risk jump in again. Most likely what's happening here is that there's kind of different sets of kids. So there's the kids who were going to be supplied. Their parents are, maybe a bit more lax, or they're coming from households where alcohol is just very common, and they were supplied very early, and perhaps unsurprisingly, we see elevated risk profiles amongst those kids. And then we have kids where the parents are really holding off as long as they can. But by 15, they essentially can't hold off anymore, and they start supplying because maybe, say, by 15, the perceived risk that they're going to get alcohol from elsewhere starts to become too high, so the parent starts to supply, and those kids also show elevated risk. But the kids that get supplied kind of maybe a little bit more naturally, they age 13 or 14, or late, age 16 or 17, we didn't see any evidence of elevated risk amongst those kids. We see a very similar pattern when we look at parental supply of whole drinks. So the previous results were parental supply of sips or more. The only difference when we look at whole drink supply is that DSM-5 alcohol use disorder association from supply from age 15 drops off, but otherwise the results are very consistent. And exactly the same when we look at more frequent supply or more regular supply on at least 3 occasions in the year. So broadly speaking, these results do kind of fall in line with previous findings. A couple of caveats on them, I guess. The first one is that some of the outcomes that we're talking about are quite rare. So alcohol use disorders, for example, aren't particularly common. We don't have that many cases, so it is harder to detect a difference. And it may be that some of those other outcomes, there is a true effect and we just weren't able to detect it because we didn't have the numbers. Perhaps more problematic is that we can't guarantee that these findings generalize, particularly at least beyond Australia. There's a reasonable chance that I would say that they are culturally specific to Australia. But even broader populations, we did have a slightly more advantaged sample of kids. We don't have good coverage of low socioeconomic status kids or regional or remote kids. So we can't be sure that the findings do generalize beyond our sample. But what we definitely see is, I continue to see, is that there is no evidence to date of any protective effect of parental supply of alcohol. So that idea that introducing alcohol during adolescence leads to more moderate drinking, we definitely don't see any evidence of that. Quite the opposite. What we see is evidence that those who are supplied by parents in adolescence are more likely to drink at risky levels later on. We see elevated risk with supply of sips, but also obviously with whole drinks. But the key thing there, I guess, is that even sips, even very low levels of supply are still beginning this risky trajectory. So it's not just that high levels of supply are increasing risk, even very relatively low levels of supply increase the risk of harm. And these findings match very well, I think, with NHMRC guidelines that suggest delaying alcohol as much as possible until, at least until beyond the control of the parents, so at age 18, which is a change in 2020. Previously, it was, the guidelines suggested delaying, but it was kind of okay from age 15, 16, and now they really do recommend delaying as much as possible and avoiding it in adolescents, which I think is a finding that these findings would agree with. So that's it from me. I will, with that, invite Wing to step in, take over. I'll stop sharing, and walk you through the mental health and substance use findings.
Thanks, Phil. Okay, so this is a little bit of a segue because it's not strictly about parental supply. This is more about general alcohol use in adolescence and how it impacts mental health and substance use in early adulthood. And just briefly, the reason that we did this paper, so it's the same analysis method as the paper that Phil just talked about. And the reason that we did this was because there's a lot of research out there that looks at the relationship between alcohol use and mental health. Some people suggest that alcohol use can increase risk of mental health problems, and sometimes it's the other way around. Sometimes it's both. But most of that research has been quite correlational. So they say that there's some sort of relationship, but we're not sure whether or not it actually, this causes that. So that's what we're trying to look at here. So we hypothesized in this study that earlier age of alcohol use in adolescence and greater quantity of alcohol use would increase risk of common mental health disorders, illicit substance use, and also some substance use disorders. This slide is going to look a bit familiar because it's almost exactly the same as Phil's. So here we've got the exposures instead of parental supply. We've got alcohol use, so at 3 different levels, any including sips, whole drinks, and then risky alcohol use, which we defined as 5 or more drinks on a single occasion, or 11 or more drinks in a single week on average. So that's according to the Australian government guidelines. We've got some of the confounders that Phil talked about earlier. And finally, our outcomes were purely in early adulthood, around 21 years of age to 23. And that's covering self-reported mental health, depression and anxiety, self-reported substance use. And then we've got our interview questions using the structured diagnostic interview, which is generalized anxiety disorder, major depressive episode, social phobia, and post-traumatic stress disorder. And also for substance use, we had cannabis abuse and dependence, and also stimulant abuse and dependence. And just to set the scene a little, this is how much young people were drinking in our cohort. As you might expect, most young people did not really consume any alcohol in the past year up until maybe age 15, which is when it really starts picking up. And even then, there's a lot of sips here before graduating more to whole drinks, and then a lot of risky alcohol use at age 18. But that's relatively typical of young people in Australia. This is not a particularly high-risk cohort. So on to the main results. A lot of graphs here, but most of them we actually did not find any kind of causal relationship. So it's a little boring from here, except for a certain bit that I'll cover in a moment. But for self-reported mental health, we didn't find any causal relationship between adolescent alcohol use and severe scores on the self-report depression scale, nor the self-report anxiety scale. Similarly, with the DSM-4 diagnoses using the interview, we didn't really find anything. Again, social phobia, generalized anxiety with the interview, we didn't find anything. But when we moved to self-reported substance use, there were some interesting findings that I'll cover now. So we looked at any cannabis use, which can be quite low. So it can just be like 1 instance of cannabis use in an entire year. So keeping that in mind. But what we found was that the earlier that young people were consuming alcohol, so for example, before age 12, the larger the effect size in terms of alcohol use predicting any self-reported cannabis use. And you can see this clear kind of slope here, where the earlier you're exposed to alcohol, the larger the risk. And even within each age bracket, so we've got any alcohol use here, whole drinks here, and then risky use here. There's also this gradient here, where the more alcohol you're consuming, the larger the risk. And so we also wanted to look at, well, what about regular use, which we defined as 6 or more times, which is quite a lot for an adolescent. Same here. We've got that slope in terms of earlier age, bigger the risk, and the more alcohol use consumed, the greater the risk. We found pretty similar patterns with ecstasy use or MDMA use. So the same age and same quantity pattern. And similarly with self-reported regular ecstasy use. When we looked at stimulant use, this was less clear. So there was only significant effects here from age 12 and before age 12 for alcohol consumption. And that might be because stimulant use was quite uncommon in our cohort. There were very, very few adolescents in our cohort reporting, or young people reporting stimulant use in our cohort. So that's the self-reported substance use results. But when we looked at the results of the diagnostic interview, so whether or not they have cannabis abuse and dependence, there's no effect here. So we didn't find any kind of causal relationship between alcohol use and cannabis abuse nor dependence, and similarly with stimulant abuse and dependence. So just to sum up, basically adolescent alcohol use had no causal effect on any of our mental health measures, but we did find that alcohol use increased risk of self-reported early adulthood cannabis, ecstasy, and stimulant use. And the risk is higher the earlier an adolescent first starts drinking and with larger quantities of alcohol used. But this is not necessarily indicative of, say, a substance use problem, because we didn't find any causal effects when looking at the substance abuse and dependence measures. So it could just be that young people who use alcohol earlier in life share some sort of risk factors with substance use. So maybe they're more likely to try the substance, but not necessarily have substance use problems. So that's that study. And I thought we're running a little bit short on time, so I'm just going to skip to a slide that summarizes all of our parental supply findings, just because that was the main purpose of the study. So yeah, just to sum up, parental supply increases risk of adverse alcohol outcomes in young people. And as I just talked about, any kind of alcohol use in adolescence increases risk of substance use. But for parental supply specifically, we saw increased risk of heavy episodic drinking, alcohol-related harms, alcohol use disorder symptoms, and also receiving non-parental supply. So this has been a whole 11 years of work, and we found pretty strong evidence, pretty consistent evidence that any supply of alcohol to adolescents, including parental supply, increases risk of alcohol-related harm in young people. And that's all from me.
Thank you, Wing. What a huge body of work that you have just presented then, and some really important findings, both from you and Phil. I mean, I know that parents really struggle to know what to do around giving their kids alcohol. And sometimes, you know, as Phil mentioned, may supply alcohol to protect them so they're not unleashed on alcohol when they reach that when they reach 18. But I guess this work shows that maybe it isn't protective relative to not supplying at all. And Wing, your findings reinforcing why delaying alcohol use in adolescence is important in terms of those links with substance use, although, yeah, maybe some unexpected findings there around what might be happening with mental health. So thank you for those two presentations. I'd encourage our audience to put any questions in the Q&A box so I can present them to our speakers. But what I might do now is invite our panelist, Nathan, to turn his camera on, if that's okay, Nathan. Thank you very much. So to give some context, Nathan is a PhD candidate and adjunct academic at the Flinders Health and Medical Research Institute at Flinders University. Nathan is a behavioural scientist focused on cancer risk reduction, particularly interested in alcohol and tobacco use and supporting priority groups, and has done some work around parental supply of alcohol as well. Now, Phil, I'm going to ask you to turn on the camera so we can see your reactions as I throw to Nathan and say, Nathan, what are your reflections, take-homes, thoughts on those presentations?
Thanks very much, Amy. And it's a real pleasure to jump in after some excellent presentations as well. And I just want to, I guess, begin by emphasizing too, I think it's hard to overstate how important this data is and how valuable a contribution it has made. I know Wing and Phil both touched on it, but I guess the amount of effort that must go into running a cohort study like this over the years to actually establishing and recruiting a cohort, maintaining it, and also the super rigorous nature of the analyses that Wing and Phil have just presented. I know some of these might be specific to Australia, as Phil mentioned, but I think we really are lucky in Australia to have a wealth of data like this from such a critical period of development as well, tracking essentially a cohort of adolescents and their parents growing up over the late teenage years. So just sort of extending that acknowledgement as well, and how lucky we are to benefit from that data in Australia. And I think, as has been touched on already as well, I guess we know from qualitative work in Australia, some complementary work that's been done by groups around the country, is that we know that parents are often providing alcohol to their children in a way that is well intentioned to try and minimize risk. As you've mentioned, Amy, we know it's done from a place of care oftentimes, but I think the key messages that come out through these cohort data like offer such potential as well in informing parents and giving them the tools to be well informed to handle what we know are often tricky conversations with kids. Alcohol can be a sensitive topic, can be one that can be awkward or sensitive to discuss. But I think walking away with some of these points from the data can actually give parents support to make decisions and put in place alcohol rules and the like. I guess that idea that adolescents being provided alcohol by parents are more likely to drink alcohol later on, and as Phil's presentation today made really clear, even small amounts like sips are starting off that trajectory of increased harm. It's a sort of key message which I guess we can use in health promotion to try and disseminate information quite widely. And I guess Wing's work as well in complement to that we know that the harms for adolescents are not specific to alcohol. They can extend to risks of other drug use too. I guess what this might tell us and give our sort of health promoters tools to take away as well, that in conjunction with the sort of NHMRC guidelines and the like, really that avoiding alcohol as long as possible to 18 is the best option. And I guess also for parents, having that good relationship in order to actually have these conversations, put this sort of groundwork in place to approach this topic early is going to be important as well. Just to step back for a second as well, and I guess one final point I'll make before I hand back, but also I just think of the time that's elapsed since the kids in this cohort would have been recruited at the start as well. We probably have lots to celebrate in the alcohol landscape with fewer young people choosing to drink, those that are often starting to drink a little bit later. And I guess, if we are seeing change over time and, I guess future research that might be tracking this as well, if we're moving towards an era where most parents are not supplying alcohol as well, I guess that's something that is going to be valuable data moving forward too. We can really sort of celebrate that, encourage and reinforce parents' decisions to not supply, sort of use those social norms approaches as well. The potential opportunity, but I guess having to counter that as well with new and emerging challenges as we see products like alcoholic soft drinks and the like, and continued opportunities for unhealthy influences to be seen by young people as well. So I think I've gone way over my 2 minutes, but again, it's just such a valuable data set that I think once you get me talking, I'm sure like many of the audience members today, there's so much in this, so many different topics we can go to from here. So yeah, thanks again for the opportunity to hear 2 great presentations, you both.
Thank you so much, Nathan. And you have just epitomized why I'm so excited to have you as a panelist, because you are such a positive and practical person in terms of your reflections just there. I think helping us to see some of the positives out of it, but even just what can parents do if they're not supplying, how else might we support parents in terms of managing conversations around alcohol. So on that note, let's move to some questions from the audience. So let's kick off a question from Malcolm. And Phil, as a biostatistician, this is right up your alley. A question from Malcolm. Do you have some effect sizes to show us? Phil, do you want to respond to that one?
I obviously do, but I didn't include them because I didn't want to overwhelm with numbers. I think, I mean, I can probably just say a couple of them because, I think it is worth kind of drawing attention to them. We're not talking about small effect sizes. So when I was talking about those effects of early supply on heavy episodic drinking and alcohol-related harm, we're talking about roughly a 30% increase in risk. So risk ratios of about 1.3. So, yeah, we're definitely not talking about kind of small effects. In the alcohol use disorder, it's even higher. It's closer to 50%. So we're seeing pretty substantial kind of elevations in risk. But there's a lot of findings in this, and I didn't want to put in all of them, and it was too hard to pick which ones. So I went with simple and suggestive. We're obviously kind of working on these for publication. Hopefully they'll be published before too long, and you'll be able to see all of the results. There are many. So all of the numbers will be there in time.
Thanks, Phil, and thanks for hinting at that sneak peek to come as to the results. I think this next question is probably for you, Wing, from Malcolm. So I guess, is alcohol a gateway drug to other substances, given you've demonstrated that kind of link between alcohol and use of some of these other substances? Maybe you want to comment around potential confounders that were controlled, or yeah, what would you say?
Yeah, I guess there were quite a few things that we did not control for. So, for example, genetic risks of, say, substance use problems or mental health problems. So there's always that. But that relationship between adolescent alcohol use and early adulthood substance use, given that we didn't find much of a relationship in terms of the substance abuse and dependence, I think it's a lot more likely that they're just more there's some sort of shared risk factor there where if you drink alcohol earlier in life, you're perhaps a bit more risk taking. Maybe you're more likely to try other substances anyway. So it's that sort of pair there, rather than that alcohol specifically, will lead you down the path of consuming a lot of other substances. But yeah, I don't know if Phil or Amy, you want to add anything?
Or Nathan? Anyone else? And the mics stay off. I think, Wing, that was a very good response in terms of, controlling for some variables, but there's still some key ones that are important to consider there as well. Now, thank you. I can see Jason has asked a question. What would Wing and Philip offer as harm reduction messages when the teenagers plan to drink and know from the parents doesn't work? But hey, Wing and Phil, I'm going to give you a break. Nathan, I'm going to put you on the spot because you kind of alluded to this before. Do you have any tips for as harm reduction messages for around these types of scenarios?
Yeah, thanks, Amy, and thanks, Jason, for the question as well. Hope you don't mind me jumping in. I think some of the perhaps data-driven messaging as well, and if we're thinking, through a harm reduction sort of lens here, has been mentioned that the risks are lesser, it seems, but certainly not no risks, but they are lesser when later in teenage years and with smaller amounts and sips and the like. And I guess sort of that's what we often see in practice, that many parents wish to introduce a sip at the kitchen table or the like as well. I guess the other message being that any amount does seem to be increasing risk as well. And I guess what this sort of data might also offer for parents too is that creating that environment early on in which to set a good example and be a good alcohol role model is often seen as quite important. It might not come down to that specific it's that specific conversation about saying yes or no at this time point, but actually building a good parent-child relationship early on, limiting availability of alcohol in the home, and being seen to sort of have a good relationship with alcohol ourselves. If that's having alcohol not as a focal point in activities, or being the first thing that might happen when we walk in the door after work or similar. All those sorts of things can contribute to creating a good environment, perhaps early on for children as well, because we know that what children are picking up and thinking about alcohol is going to start so much earlier than at 12. There's opportunities to be teaching and being a good role model, from the real early years.
Thanks, Nathan. As I said before, always such practical and positive advice. Wing, Phil, anything you want to add on top of that from the findings? Phil?
I guess the only thing other thing that I'd say is, I think what Nathan's said is very true. You know, cannot underestimate the role of parental modeling of drinking, and things like that. But I'd also kind of maybe challenge the assumption of a little bit. So we know that, you know, like the more you drink, the higher your risk. And that idea that parents can supply, and somehow that supply is going to mean that that kid doesn't get alcohol from elsewhere, like, it's like we have no evidence that that happens. So in reality, parental supply is very likely to just increase the amount of alcohol that that kid is drinking. So, like, yes, it's very difficult to say no, and especially if you think that your child is just going to go and get alcohol from elsewhere, it's going to be really hard to say no. I think we need to support parents in the idea that to a certain extent, like, you can only go so far. Like, if you say no and they go and get it from elsewhere, you're like, you're a parent, you're not their jailer. At a certain point, and particularly when we're talking about kids that are getting to 15, 16, they're going to make their own decisions. You can guide them, you can recommend to them, but all that we should really be expecting is that the parents themselves are not increasing the risk. So I think we need to support parents to say no, and with the understanding that saying yes is not going to reduce the risk. But being very consistent, having strong rules, having good modeling behaviors, maybe in the long term might decrease the risk. So that's what I'd say.
Thanks, Phil. Wing, anything that you want to add on
Nothing
to
else to
that?
add. That was all very, very well covered.
Yeah, thanks both. There's still some questions coming through on the chat and some great suggestions. So where was I? A question from Doug in terms of, will you be able to continue tracking your study group? Be interesting to see what happens over longer term. But I'm also, Anne-Marie, trying to make more work for us, but this is good. You know, and as you alluded to, Nathan, you know, there's been some big changes since this cohort were first recruited and have passed through adolescence. I wonder how things would look if we ran this study again today. So I don't know, if maybe Phil, I don't know if you want to kick off with the question of, could we keep going and see what happens beyond those early 20s?
It's going to be difficult. We've spoken about it. We every maybe like 6 months we have this conversation about what we can do with these kids. Unfortunately, you know, like, maybe the big opportunity is a missed one. I think we should have 10 years ago maybe asked if we could have linked their data, but that ship has kind of sailed. I think maybe we'll come back to it one day, but you know, like, it's now increasingly difficult to follow these kids. Well, they're not kids; they're mid-20s now. But I also do think, I mean, I would love to get their data and link them and see what happens when they're in their 30s. But I do wonder if it's the best use of resources that we can have, given that so much has changed in young people. And while it is important to understand what happened to these kids, it kind of, like, there's a reasonable chance that young kids now aren't getting supplied by their parents, that they aren't having these harms, and that it's not really going to lead to any kind of sensible interventions or anything like that, because the interventions have already happened without us kind of leading them. They've happened naturally. The change has already happened. So I definitely think, you know, like, the thing that I would really love to see is maybe like a repeat of the APSLS cohort, a new cohort of young people now, so that we can really look at whether, like, we obviously know from population level kind of studies that alcohol use is declining. Young people are not drinking as much, they're initiating later, there's greater abstention, all of these things. But is there still parental supply happening? Is it changes in other supply that's actually, is it changes in drinking culture? Like, what's driving this? And does it at least partially come down to just less supply from parents? Because it might be that maybe this is the one case where the NHMRC guidelines really are being followed. Who knows? I would really like to see a follow-up study that looks at kids now.
So that might be a good time to say, watch this space in terms of what may come next, building from APSLs. Thank you so much, Wing and Phil, for your presentations today. Thank you, Nathan, for your reflections, and thank you to our audience for joining us. Now, in terms of what's coming up next, speaking of APSLs, here's one of the key players from the APSLs cohort. We have Associate Professor Delise Hutchinson from the Centre of Social and Early Emotional Development at Deakin University, such a fabulous collaborator, who's going to be presenting on parental substance use in the perinatal period and child development, bringing together evidence from longitudinal studies and systematic reviews. That's going to be on the 1st of August, so next Thursday, a webinar not to be missed. Before we wrap today, for some of you who are joining who have an eagle eye, you might have spotted a blue streamer in the background of Wing's video. It is Wing's last day today as a postdoctoral research fellow at NDARC, as Wing moves to take on some biostats training. Wing started on APSLs as a research assistant in 2017, did her PhD on APSLs, has done some of her postdoc work on APSLs, as well as broader our correlated harms, and alongside Phil, Alex Eichen, Richard Maddock, and a whole raft of others, has been absolutely pivotal to the APSLs study. So I was just thinking about how I'd describe your contribution, Wing, and I think if I had to pick 3 researchers that I'd want to hang out on a desert island with, you're probably at #1 pick for me. So we're going to miss you greatly at NDARC, but we know there's great things ahead, and I think it's probably time to eat celebratory cake and celebrate all that you've achieved while at NDARC. So thank you for that. Thank you everyone for joining and hearing about the study, and have a lovely afternoon. Thanks.
Thank you.